At the National Hospital Abuja, health experts, policymakers, and frontline workers are gathering both physically and virtually for one message: caring for health workers is just as important as caring for patients. The hybrid webinar themed person centered practice and caring for the carer is spearheaded by the Health Action Training Nigerian chapter. Speakers at the event highlight a simple but powerful truth. When doctors, nurses, and caregivers are supported mentally, emotionally, and physically, they are better equipped to deliver compassionate, person centered care to patients.
Often at the cost of their own well being. The result can be burnout, compassion fatigue, and emotional exhaustion. When the carer suffers, the quality of care as well suffers. A tired nurse, an overworked doctor, or a stressed family caregiver cannot give their best.
The qualities in us. So we work by that. If you are good at counseling, we push you to do that. And not only that, because we also do supervisory visits to facility, hospitals, we tend to know our strengths and align our work activities around those expertise. Then when you talk about the psychological, you cannot divorce emotional from psychological. They are all interwoven. So what do we do in that regard? We celebrate our strengths.
The webinar featured interactive training, wellness strategies, and practical tools designed to help healthcare workers cope with stress and burnout. Nigeria, like many nations, faces rising challenges: shortages in manpower, heavy workloads, and the emotional toll of constant emergencies. For many participants, this initiative is more than training, it's a lifeline. By creating a space where carers themselves can be cared for, organizers hope to set a new standard, one that recognizes healthcare workers as people first and professionals second.
What we noticed about nurses in Nigeria who joined, and this is online, it's on Zoom, 20%, over 20% of our attendees for the session are Nigerian. And that showed to me that these folk in Nigeria, I thought these folk in Nigeria are driven, are passionate, will take chances on training, want to improve themselves, and they deserve more attention. What we also do is we have a pathway called our Hat Trainer Pathway, where we develop skills for people to share this approach with others so that they are able to do it themselves in their own regions. It's something that's been a foundational principle from day one for us.
This is a needed, kind of program. It's an important program to integrate into the training of our nurses in Nigeria, because it is basically about communication. You must have gone to the hospitals before, you have been attended to by nurses, and you have that professional communication gap most of the times. You can see nurses who are rude. You don't know why. We're not, blaming them, because that also boils down to what is being discussed here: caring for the carer. So it means that from the employers, from the government, from the policies available in our spaces, the care of the carer must be taken seriously.
The message is clear: healthier healthcare workers means healthier patients. Sheyi Ankpiton, Ellen 24/7, Abuja.